So hi everyone. Welcome to the final session of what's been a very interesting conference, I must say. In this session, we're happy to have some of our great sponsors of the conference present their exciting innovations and perspectives. So first out is NVidia, together with a local Norwegian partner, Nextron. I'd say that on anyone's list of important companies in artificial intelligence over the past decade or so, NVIDIA will be high up there, near the top, as they provide hardware and software used by essentially everyone doing any kind of deep learning. And it wasn't until one could easily use their accelerators for training deep neural networks that the field really blew up. And since then, they've produced a lot of high-impact research, and this includes applications of machine learning in healthcare. It's therefore very exciting to welcome Craig Rhodes, who's the NVIDIA's Europe, Middle East, and Africa lead for healthcare and life sciences. And among many things, he works closely with the Medical AI Center in London that I know is very familiar to many of you. Because it's a major source of inspiration for a lot of activities at MMIV, both organizationally and scientifically. So Craig poses the question, is AI revolutionizing healthcare? And we're very excited to hear your thoughts on this, Craig. So please.
Thank you very much. I'm glad to be, well, I would be glad to be there. I'm glad to be part of your conference. My name's Craig Rhodes. I manage health and life sciences for NVIDIA. So I've been in healthcare for about 20 years. So today I'm going to pose a couple of questions around healthcare and give you a bit of a flavor of what NVIDIA is doing, how we're working, and some of the kind of the areas of innovation that are really happening that we see with this industry. If you don't know NVIDIA, I'm sure some of your children in the who are doing gaming will do. We are, a graphics GPU company, graphics process unit, but we're also producing software and solutions. So out of NVIDIA's 18,000 people, nearly 80% of those are engineers, and half of those are software engineers as well. So, we're not just GPUs creating the hardware, but also the software as well. Let's talk about healthcare quickly. It's hard. It's really not very easy. We know that the world is in a very interesting place. In some cases, terrible things happening. Just hearing some of the announcements about the deaths in the US today, some of the more positives around the vaccines, but also listening to some of the adverse events around the vaccines today with patients that have certain conditions as well. There are many challenges. We've got an increase in patients. We know that people are getting older. The more people in this world, this is a slide I used many years ago, and I constantly use this. This could not be more true about delivering new drugs. We've worked very much with the big pharmaceutical industries. GSK, we've done announcements recently with GSK about being, their AI partner. But it takes them 10 to 15 years to deliver new drugs, over $2 billion. 80% are failure candidates, and we're now in a pandemic that we need to change that. We need to completely reverse that kind of dichotomy. There's limited expertise. Talking again today about radiology, we want more radiologists, we want more clinicians, we want more nurses into our organizations. But we're seeing a reduction of those. But we're hoping artificial intelligence can change that. Bringing clinical and AI together makes it a very interesting domain now, makes it really interesting. And actually, we've just employed one of our newest employees in our group. He's a consultant cardiologist from Ulster in Northern Ireland. but has got a huge interest in artificial intelligence. So he's going to help drive some of our clinical programs. Complex large data sets, I'm sure you'll all understand this, 2D, 3D rendering. The images, and I know Siemens are presenting after that, big partner of NVIDIA, just the quality of images that we are seeing now, the amount of images that are coming off, absolutely huge. The regulation of technology as well is becoming a massive challenge for just being able to get these algorithms through the complete process and the procurement process. So, you know, if we look at all of the challenges, it's enormous, the challenges that we do have in the healthcare system. One of the things that we are seeing, though, is we are seeing this new revolution in smart devices. And again, you know, lovely to see Siemens up there. These devices are using GPUs to become, produce higher quality information, higher quality GPUs to be able to produce higher quality visualizations. Down here on the left-hand side, we've got an Oxford Nanopore, which is a nanopore sequencer. This is a sequencer the size of a very, very small, sorry, just I'm going to have to pause it a second there. Just that's banging at our door. So we've got the smart revolution of the devices. I'm very sorry about that. That's happening in the world. And this Oxford Nanopore sequencer, this is a sequencer the size of your hand. It's absolutely tiny. And we're being able to sequence a whole genome in a very, very short amount of time. So these medical devices, enormous revolution. As well as that, we are now starting to see breakthroughs in computational genomics. Many years ago, if you looked at the volumes of the genome, there's many kind of volumes that are stored in big books to show you how a genome, a human, is made up. But now we can sequence one in 22 minutes. If we, again, looking at the Oxford Nanopore, the Promethean sequencer, we can do that in around about 22 minutes, go through the 3 billion base pairs to be able to sequence that. And what actually 3 years ago, NVidia wasn't really looking at genomics as an area of interest for GPUs. So very, very interesting that in such a short amount of time, NVIDIA has really taken upon itself to look at how sequencing can be really accelerated by GPUs. Now what we're seeing here, we're seeing the imaging, and we're starting to see the DNA data as well being used. And a great, introduction to one of the, our kind of fundamental AI programs with King's College London. This is my boss on the right-hand side, Jaap, and this is Sebastian Olsen on the left-hand side from King's College, who's doing one of the largest medical imaging programs probably in the world. Using Siemens sequencers, looking at 12 clinical pathways. So this isn't just a single pathway. This is looking at neurology, oncology, and cardiology. They were deploying it, so we started with 4 hospitals, started quite, not so small, but 4 trusts. These were from East London to West London. Looking at a very diverse set of population as well. If you look at West London in places like Chelsea and Kensington, very, very affluent population sets, usually Chinese, Saudis, Qataris, Russians. You go to East London's, lots of Indians, lots of Pakistans, lots of people from Italy, Ireland, maybe some Londoners, some real Londoners there still in the mix there. So very, very diverse set of population. But now we've moved that over into 11. That's going to be 11 NHS trusts. That's 26 million patients. So 26 million patients, bringing artificial intelligence from neurology, oncology, and cardiology to that. That's enormous. 3 years ago, we couldn't think of that type of scale of what we're doing. And what that's really taken the a kind of view on artificial intelligence of this kind of multidisciplinary team. Now, we talk about that when we talk about cancer boards, where we bring on the oncologist, we bring the pathologist, we bring the nursing teams to look at cases. We decide the best practice for those particular cases and what we're going to do and why we're going to do it. But we have to have the same with these big programs, these big AI programs. They have to have, you know, the senior buy-in from the clinical teams. They have to lead them. They have to be the ones that understand how are we going to develop the artificial intelligence, the algorithm, where is it going to fit into the clinical workflow? How will it be deployed? How will that data be visualized? How are we informing the consultant, not telling the consultant, and operating in that way? We also have to have the data scientist. We have to have the people who understand that data, the coding of that data. Is it SNOMED? Is it ICD-10? What is it, so that we can really understand when we're actually translating it, what we do. So it's been revolutionary, but this is not the only program that's going on. There are many other programs that's going on as well. We're also seeing now supercomputers popping up for healthcare as well. Artemis is in the UAE. Looking at COVID-19, looking for understanding the genetics within the UAE, looking for those COVID type patients, looking at for the real understanding of what type of patient for what type of vaccine is going to help. So again, these are supercomputers of enormous scales. Again, years ago, we weren't talking like this about healthcare and whether artificial intelligence is really going to fit into that kind of domain. More recently as well, we've been working again with organizations like the Sanger Institute. And the Sanger Institute are looking around cancer, are looking at a program called mutagraphs. So looking at mutations within your DNA signature. Based on your historical lifestyle. So based on the lifestyle that you've led, you know, maybe you've been a smoker, maybe you've been a drinker, you know, has that had an effect on the mutation of your DNA signature? And if so, does that mean that certain drugs that you may be administered have a positive, have no effect, or have a negative effect on you as well? And this has been an enormous program by the Sanger Institute. And actually, the project that we worked on for that, it was called SIG Profiler. And SIG Profiler ran around about every 28 days. We could run it as a large matrix multiplication challenge. And we optimized that so that it ran in under 8 hours. So just think how this fundamentally changed the science of what they were doing. They changed it so that it would, you know, we could do over 364 iterations a year rather than 12 iterations, which it currently was running at. So again, enormous value that just bringing the GPUs and being able to optimize those for their particular challenge. And this is for one of the largest clinical challenges in the world. Talk about revolutionizing genomic testing as well, and we start to talk about the, you know, the real triangle of data. You know, it's key that we bring genomic data together with the imaging data, with the clinical data, to really be able to understand patients, and especially if we look at the world that we're in with the pandemic, the challenge that this has for knowing what type of patients are going to react well to the particular vaccine, which kind of patients won't react very well to it. This is going to be really fundamental for the industry. And again, just a promotion for Oxford Nanopore. This kind of small sequencer here, this is actually for testing cassava, which is a root vegetable in Africa. So rather than the test being sent off to a lab and then 3 weeks later getting the results back, they can actually now do that in the field. And actually, we built one of these sequencer with an actual inbuilt display, so it can there and then tell you the exact results. And this is looking for whitefly disease. So rather than waiting 3 weeks and then having your crop decimated, you can tell there and then whether a particular plant has a disease or not. And we don't do this without in just the UK. We've got a lot of great success stories as well. We are certainly doing a lot of work within the Nordics with Oslo University Hospital. Recently have acquired one of our large DGX A100s. We know you guys at University of Bergen have been using GPUs and have got access to those as well. So it's not just in the UK that we're seeing this. We're seeing across Europe AI becoming a fundamental part of their programs. And my desire is always that they have to have implications at the point of care clinically. So rather than just research programs, that we find ways of deploying these in the point of care so that they take advantage of patients and improve the patient clinical pathway. We're seeing a lot of work in pathology, and certainly the work in Oslo University Hospital around pathology. And this is around the size of the images as well. And all of this work actually is with one of our great partners, Nextron. And we don't do any of the work that NVidia does. We don't sell our GPUs direct. We always sell them through partners. And they are part of the success of what they do. They help implement the DGX technologies or the GPUs. They help with the training. They help with understanding how these can be implemented in these organizations as well. And again, it's that multidisciplinary team. It's not just NVIDIA there, it's our partners who are also supporting the data scientists and the clinical teams in being able to do this. So very, very important for this. So a lot of things going on in the Nordics as well. Why is NVIDIA good? What are we doing that's really, really well? Well, just if you look at the acceleration that you can do on a GPU across these, and these slides will obviously be shared with all of you. We're seeing huge demand at the moment in the pharmaceutical industry around natural language processing, and you can probably imagine why. But things like imaging is an area that we're very, very heavily focused on, whether radiology, and as I said, more so now with pathology. We actually have a solution called Clara, and that's a toolkit for radiology. But it's also a toolkit that will be used for pathology as well. But then looking at some of the pharmaceutical work, the docking type work, that's amazing, this kind of acceleration. And this isn't percent, this is X. So this is 20, 30X bigger. So, and as a very simple example, we're working in tuberculosis with cows with an organization called Roslin, who very famous organization for sequencing Dolly the sheep. And they've accelerated identifying tuberculosis from 3 weeks to 30 seconds by using GPUs. And we rewrote their application. We helped to rewrite their application. So part of the value of NVIDIA is not just around providing GPUs, but it is also in helping to accelerate. We've got, as I talked about before, it's not just the hardware platform. We produce a lot of software, and whether that's software for DNA sequencing, which is Parabricks. We've just produced a tool for natural language processing, a wonderfully named tool called Biomegatron. As you know, we do a lot of imaging. A lot of work with Siemens has been doing around that, but many other different things as well, from drug discovery. We've got a tool around Guardian, which is being used at the bedside for patients as well. So the software element to what NVIDIA is doing is really helping to bind the GPU, the power of the GPUs, and the data. That's really, really important as well. And if we just look at the Clara Imaging, this is a framework that you can all go to GitHub and go and get and going to take. We've got an open source version of this called Monai. And this is a real Kickstarter for you for going and being able to start your imaging programs and being able to build those algorithms, whether they're utilizing, some of our lung. We have models, pre-trained models that you can take and use, whether it's lung. We've actually got a pre-trained model for COVID-19 based on CT as well. But it helps with annotation, which is obviously hugely important in the AI world. And then obviously being able to deploy these within your own kind of frameworks as well. So these toolkits are there to be deployed within your workflow as well. And then if you look at Nextron, who are one of our key partners for Norway, was key to our successes in being able to deliver that. It's not just about the GPUs. We've got to have the storage that's able to deliver with it. The quote that GSK made was that within the first 3 months of this year, they acquired more data than they had in their 300-year history. So enormous amounts of data. So that data, yes, it needs compute, but it needs storage as well. And then alongside that, workstation. Yeah, we have to, alongside Nextron, NVIDIA and Nextron are training people as well. We have our Deep Learning Institute that we work together on. So whether it's high-level artificial intelligence training around AI, or whether it's very, very low-level CUDA training, understanding how to optimize your applications for GPUs, we have the people between Nextron and NVIDIA that are able to do that work. So again, really key to bring both partners into these kind of collaborations very much to help you. And, we really want to be able to get these models developed and get them out onto the hardware and be able to ensure that they're optimized in the best possible way so that you're maximizing the amount of your GPUs. So, Nextron, enormous intro for them, as a partner who we've had a long history with as well. So for all of your GPU kind of requirements, please go and talk to Nextron. And I'm going to kind of finish up with a couple of slides. One, just to show the investment that NVIDIA is putting into healthcare and life sciences. You may have seen the news that we're putting a supercomputer into the UK called Cambridge One. It's not actually in Cambridge, but it's called Cambridge One. It's going to be the largest supercomputer in the UK. So it'll be number 29 in the world. It will be the third greenest computer. It comprises of 80 DGX A100s, so enormous power. And their first customers are going to be AstraZeneca, GSK, King's College London, Guys and Mrs. the NHS and Oxford Nanopore. And it's there to support the acceleration of really trying to work on that vaccine, work on the clinical user cases coming from the pandemic. If you look at London at the moment, we are in a very, very bad second wave of COVID-19. We need all of the tools at our disposal. So this is a supercomputer that NVIDIA is investing in. So this is our supercomputer that we will be deploying on the ground, and we will be allowing our key customers and partners using. None of these organizations are paying for this. This is not a replacement for a AWS or a Cloud or a Azure. This is to do some of the biggest fundamental science kind of big challenges out there. So hopefully we can, shave off years off experiments or improve quality of those experiments massively. So fundamentally, this is changing the game, having GPUs on here as well. And just to, a final word, our latest supercomputer is the DGX A100. Where this is one of the fastest servers in the world. The software that sits on top of it, the NGC software, contains hundreds of already optimized applications. And once again, just another kind of name for Nextron, to please go and contact Nextron to talk to them. But fundamentally, to finish, we see there has been a shift in how artificial intelligence is moving from the research world into the clinical practice world, and how it's changing the world that we live in right now. And this is something that has accelerated because of the pandemic. But of course, we will continue to do this as the world moves forward with the vaccine as well. So I think artificial intelligence is definitely here. We've got a long, long way to go. How we deploy it at the point of care, how we ensure the ethics and the governance behind it are going to be some of the most important questions that we'll have to answer over the next coming years. Thank you very much.
Thank you so much, Craig. It's always great to hear from you. You are extremely well placed in seeing what's going on in the field, as you sort of, through your partners, are into all projects essentially in this specific domain. So that's great. We have some questions for you. So maybe let's see. We have a question. Okay, a question from Hauke, who's in the room. It's obviously useful to use GPU for model training. How about using the models, like doing prediction or inference? Do you think we will need specialized hardware solutions for this as well, or is CPU sufficient?
Yeah, really good question. So from our perspective, one of the things that we've realized around about, some of our big GPUs, they cost, they're quite expensive. They are very, very good for training. But for inferencing, yeah, you could get away with using a CPU. But with the latest carnation, so if you look at the latest GPU, the A100, so in the DGX that you see here, there's 8 A100s. We've actually allowed you to split up that GPU into 7 component parts. It's called MIG technology. So it allows you to run different applications on each of those on one single GPU. So this is something that a lot of our customers have been asking for. And that then allows you to maybe inference on a couple of those instances while still training on another one of those instances. So again, using the A100, you can cut that up into component parts. There are also different GPUs as well. There's A6000 or a T4, depending on different workloads on visualization. So yes, we are definitely hearing the inference market is going to be a very serious market, and the A100 helps with that, with the MIG technology.
Great. Another question. Considering your role in Europe, Middle East, and Africa, do you think that AI will sort of revolutionize healthcare at the point of care in richer countries, or the countries with the less developed healthcare system first?
Yes, and it's an interesting question. And actually, on the news today, one of the comments was actually the stockpiling of vaccines by richer organizations, and it was quite an interesting comment about how this is going on. One of the pieces of work that has been done at King's College London is actually being able to take the demographic split across different areas of London. So not all of London is rich, it's not all affluent. So part of the programme for King's College London is to look at the affluence of the areas. So looking at areas like Chelsea and Kensington, which are very wealthy, but then looking at other areas in South London, which are much kind of more impoverished. They might have a much bigger diversity of population sets as well. So I think a lot of these programs are taking into consideration that not always are you going to be able to have the best healthcare system, the most latest up-to-date information or medical equipment, but you should be able to still provide the best possible quality of care. And again, most of the programs that we're seeing, actually, there's one that we're involved in that's looking at how in certain parts of London, COVID-19, the mortality rate of specific ethnic minorities are much higher than other certain classifications, and so that's one of the projects that they're working on. So I think it has to be diverse. AI has to be diverse, and it cannot rule out whether you live in one type of country or another, or whether you're rich or whether you're poor. And actually, I do think this is when you look at the programs like King's, looking at the affluence as an indicator is really important, because usually it's the kind of people that are maybe nervous about going into hospital. Maybe it's not their first particular language. Maybe they don't like, or they're confused about the language that people are talking about. Maybe these are also areas that artificial intelligence can help. I think there is a question around how do we ensure that people feel comfortable with artificial intelligence in their healthcare setting. And I think that's something that also needs to be done, and from an ethical perspective needs to be considered as well.
Thank you. Let's wrap up with a more technical question from Frank here in the room. He's wondering, how does the DGX work? I mean, in practice, is it like a supercomputer, or do you log on to it, or is it more like an external GPU, or?
You still kind of log on to it. We attach it to what's called NGC, which is our optimized application. So if you look at, or you Google or use another browser, NVidia NGC, basically that connects you to a containerization system, and that's got all of your usual scientific applications like Relion or GROMACS, but has got TensorFlow or Caffe or PyTorch or whatever. So it's a very similar sort of interface. You can use Ubuntu, Red Hat as well. So it works like any other kind of server. It's there when you use it with our software tools like Clara for medical imaging. It's there to really accelerate how to develop these algorithms very rapidly and deploy them very rapidly as well. So what we're trying to look at is bringing together both the software and the hardware to make it really seamless in that journey, to get up to speed and develop these algorithms, get them deployed, and obviously get them clinically validated, because that's one huge thing that we need to do.
Great. So thank you again, Craig, for an excellent presentation.
Thank you very much.